Okay, this is 6-34 or 134. Thumb index grasp, metacarpal phalangeal or interphalangeal with hand stabilization, long axis distraction, IR, APE, PA glide, lateral to medial, medial lateral glide, or medial lateral, lateral to medial tilt. So on this one, patient is going to be seated with arm and slide forward flexion. The doctor is going to stand facing the patient on the affected side. Segmental contact point is going to be the distal end of the affected phalangeal joint that we're trying to find. On this one, I'm going to do the second digit of the left arm. So I'm going to grasp with my distal hand on the proximal end of the distal joint that we want to find, and then inferior, or I guess proximal hand, is going to clasp the distal end of the proximal joint. So I'm going to come in and I'm going to do a thumb index finger grasp. That's going to be my contact point, and the thumb index finger grasp is going to go on the joints that we were wanting to see. So on this, I can finding the joint in question. Then I can go long axis distraction. So pull my thumbs away from each other. I'm gonna assess for joint motion here. I feel loss of spring motion, so then I can slide long axis distraction, come back, reassess, then I can go lateral or medial to lateral glide. Feel loss of spring motion, then I can medial to lateral glide, and that's my vector. Come back, reassess, joint motion has been restored, then I can go lateral to medial, feel loss of spring motion, lateral to medial vector, come back, reassess, then I can go internal rotation, feels pretty good on this one on the assessment, so I'm going to adjust that. Then I can go lateral. Oh, I guess this one was lateral, and now I'm going to go medial tilt or medial rotation, or I guess internal rotation. And then I feel loss of spring motion, so I can internally rotate, come back, reassess, and then I'm going to go medial tilt. Feels pretty good, and then lateral tilt feels pretty good, but I'd also adjust medial tilt or lateral tilt on that. And then I can just move down the joint segments and then repeat all of that all the way from digit 2 to 5. And I guess I could do that essentially on the first digit, but not very much rotation or tilt is going to be happening here at the first joint. I guess it could, but typically this is going to be from digit 2 through 5.